everyone. I'm Dr. Ella Dyer, and I've been working with Kaya and Steph on the qualitative work package for Through Pregnancy and Me. I'm just finding my slides. Hopefully you can now see them okay. Great, so bear with me. Okay. No. So the qualitative objectives of the study were to explore and understand the lived experiences of food and eating during pregnancy. So, for example, people's decision-making processes related to food choices, including influencing factors and coping strategies. And also we wanted to investigate kind of people's perceptions of food insecurity and the support that was available and what impact this had on their nutrition. So we talked to people about any barriers and facilitators they had to eating healthily. We focused on kind of those dimensions of food insecurity that Nicola talked about at the start. And ultimately, this helps us to bring the findings to life so that we can inform the development of interventions and contribute to policy recommendations. So in terms of the study design, I've lost my mouse, and methods, Kaya and I talked to some of the people who filled in the survey that was sent out and said that they were happy to talk further so that we could learn more about their experiences during pregnancy. So we spoke to a total of 24 people, 12 at Coventry and 12 at Gateshead, and most of these interviews took place over the phone. The interviews were semi-structured, so we had a topic guide to help us with that conversation. And basically, we just wanted to find out more about some of the responses that were given in the survey and get a better understanding of the challenges that people faced. So we recorded these interviews and typed them up, and then we used reflexive thematic analysis to analyse the data. And this involved coding the transcripts and then grouping these codes into themes. And of the 24 people that we spoke to, we had quite a mixture of people, really. There was 15 people living with their partners, 11 of the participants had older children, 6 had gestational diabetes, around half received, well, exactly half, received universal credit, and half were working during pregnancy. And quite interesting that there were 2 chefs and 3 carers that we spoke to, and like 4 of these 5 people either had to quit their job or were not given shifts when they became pregnant. So yeah, it was very, very interesting conversations. In terms of the levels of food insecurity, we spoke to a range of people, and as they kind of indicated on their survey that they're kind of through the questions that we asked what level they had, and there was a fairly even split across low, medium and high levels of food insecurity pre-pregnancy, although the levels were slightly lower during pregnancy. So part of the interviews we were kind of asking about why things had maybe changed, and generally speaking, this was because people did receive more help from family and friends during their pregnancy. So in terms of the findings, it can be seen how pregnancy can be like a perfect storm in terms of the challenges that women face during this time. And I have recorded a short video to summarize some of these findings that I'd like to share with you today. Just bear with me, see if I can work the tech. I'm worried I didn't press the right button to share my sound. So could someone shout if they can't hear, please?
Hi everyone, we're pleased to share some of our early qualitative findings from the interviews that we have had over the past few months.
Can you hear that? Marie's got a hand up.
Yes.
Yeah, we can hear
it. We're here. Okay.
We found that everyone had different stresses in their lives, which directly affected their experience of pregnancy and ability to act. For example, people experienced pregnancy conditions like gestational diabetes, morning sickness, preeclampsia, bleeding. Women talked about having financial concerns or debt or employment issues, housing issues, looking after older children or caring for relatives. If the baby isn't growing as much as they should be, is anyone actually taking into consideration it's because the woman's not eating enough? Or they're too stressed worrying about money? Participants described this support was sometimes informal, so family and friends, formal through healthcare professionals and midwives, and from the voluntary or community sector or government or council services. My midwife was an amazing proactive source of support. She even wrote to the council. When I was still pregnant with the second one, there was a time where we were like desperate, where his man was cooking us a meal and stuff. We weren't saying anything, but when she was asking if we wanted something to eat, we were like, yeah. But not everyone felt like they had a strong support network. For example, one participant said, I don't have a very supportive family. My family dynamic is. In some instances, the services that were intended to support actually ended up being a source of difficulty. It was as though the rain ran off the support umbrella and formed puddles of additional challenges to navigate. For example, participants shared how they were impacted by systemic issues. They described systems that were largely opaque, broken, difficult to navigate with confusing eligibility criteria. Systemic issues also included accessibility of shops, public transport, and employment issues and maternity policies. Participants shared how societal expectations shaped their experience of food insecurity in pregnancy. For example, women tended to shoulder the domestic load, emotional labour, caring for older children, and often put others' needs ahead of their own. Stigma permeated the data. Women spoke about how shame, blame, judgment, guilt, fear, failure, and embarrassment literally saturated their experiences. If you're like, oh yeah, I can't afford to put food on the table, they're just going to go, all right then, well, social services will be taking your kid off you at birth. It is that kind of scaremongering that worries you, that if I ask for help, are they actually going to help, or are they going to get social services involved? During my pregnancy, if I was ever asked for stuff that I needed, like food or stuff for the babies, I'd just say, no, I've got everything. I felt embarrassed and ashamed to ask for help, especially from healthcare professionals, because it's more the fact of like, how do you learn to trust that person that you've known for such little time or you don't know at all? Some people had more stresses in their lives, which seemed to contribute to the extent to which they experienced food insecurity in pregnancy. When people are struggling, obviously we're getting food and stuff. That's when your mental health goes down as well, because you're constantly not only worrying about yourself and your new baby that you've not had yet, you're then worrying about if you've got any other children or you've got other bills that you need to pay. This additional stress could overwhelm any support mechanisms available. And you can begin to see that the more stress, the more systemic issues, societal expectations, and stigma puddles that people face. And the bigger the puddles, the more there is to evaporate into more stress, perpetuating an endless cycle of stress and worry. Some people had more robust support in place, which helped to shield them from the downpour of stress. But there seemed to be almost a side wind of precarity that could not only knock people off their feet, but could turn the support umbrella inside out. For example, this could be losing a job, being evicted from a rental property, or unexpected costs or household bills. Everything that could have gone wrong went wrong. It was just horrendous. And it was almost as if this side wind could speed up the cycle of transpiration and precipitation. Creating the perfect storm. So we asked people what support would have been helpful or what could have been done differently. And we've condensed these suggestions into potential recommendations. And whilst we can't stop the rain, a bigger support umbrella may help protect women from some of the downpour of stress that they face. Or perhaps the recommendations could be a combination of support and sunshine to both offer shelter from occasional showers and dry up the puddles of stigma and other societal and systemic issues, which ultimately offers the potential to reduce the size of rain cloud that can develop in the first place. Thank you for listening. We'd love to hear your thoughts about our findings.
Okie dokie. So in terms of the findings, we can see how, well, there's a lot for us to get our heads around, because this is really complicated and nuanced stuff. And, you know, there's so many dimensions to it and spans many different layers. And these experiences were not uniform in the slightest. So there's a real need there for tailored responses. But it does start to highlight some of the urgent priority areas that we can focus on. And I think it kind of highlights how this kind of perfect storm of challenges that women face has the potential to undermine mothers' beliefs in themselves as good mothers. And this seemed to have an effect on the mental health through increased anxiety, depression, and maternal self-sacrifice, whereby women talked about deprioritizing their own physical, nutritional, and emotional needs to put others first, which reflects an apparent acceptance and possible normalization of maternal self-sacrifice. So in terms of our next steps, we have just submitted an abstract for the Global Food Security Journal to write up these findings. We've successfully applied for a policy support fund to turn some of these findings into policy recommendations. And we're also planning on submitting an Impact Accelerator Award so that we can do some more work to make impact with these important findings. So thanks very much. I'm going to pass over to my colleague now, Kaya. I'll just stop sharing.